Imagine waking up every morning to strong, steady legs that carry you with ease and confidence. No more sudden leg cramps disrupting your sleep. No more weakness holding you back from enjoying your day. Just strength, stability, and the freedom to move without pain. In this video, we delve into the top 7 essential vitamins and minerals that can help seniors strengthen their leg muscles and prevent painful leg cramps. Backed by scientific research and expert recommendations, these nutrients play a crucial role in maintaining mobility and independence as we age. I once had a patient. He was 72 years old, kind-hearted, and full of life. But he had a problem that many seniors quietly endure. His legs were failing him. Crippling cramps would wake him up in the middle of the night. His muscles felt weak, and just walking to the mailbox felt like climbing a mountain. He thought it was just aging, but we dug deeper, and what we found was eye-opening. His body was starving for key nutrients that help muscles function properly. Vitamins like B12, D, and magnesium were all lacking, so we adjusted his diet. We introduced nutrient-rich foods and added a few carefully chosen supplements. And within weeks, he began to feel the difference. The cramps stopped waking him. He could stand for longer, walk farther, and most importantly, he felt like himself again. That's the power of targeted nutrition. And if you or someone you love are struggling with similar issues, you're not alone. These 7 nutrients can be life-changing. Let's dive in. Let's begin with vitamin D, often called the sunshine vitamin, and for good reason. It plays a crucial role in how our bodies absorb calcium, which directly supports bone density and muscle function, especially the large muscle groups in our legs. But vitamin D does more than support bones. It acts on muscle cells to promote proper contraction and strength. A 2022 study published in the American Journal of Clinical Nutrition found a strong link between vitamin D deficiency and dynapenia. That's the age-related loss of muscle strength, which is a major risk factor for falls in older adults. According to the CDC, 1 in 4 adults over 65 falls each year, often due to muscle weakness and poor balance, conditions that low vitamin D levels can worsen. What happens when you're deficient? Low vitamin D can cause muscle weakness, particularly in the thighs and hips, leg cramps and joint pain, fatigue and low energy, bone pain, and increased risk of fractures. How do we get enough? Your body produces vitamin D when exposed to sunlight. Just 15 to 30 minutes of direct sun on your skin a few times a week can help. But as we age, our skin becomes less efficient at converting sunlight into vitamin D, especially for those with darker skin tones or who live in less sunny climates. So it's also important to focus on dietary sources like fatty fish, such as salmon, mackerel, and sardines, egg yolks, fortified foods like milk, orange juice, cereals, and plant-based milks, cod liver oil, which is an old-school but powerful source. Supplements. Many seniors benefit from vitamin D supplements, especially those who are homebound or have limited sun exposure. The recommended daily intake is generally 600 to 800 IU per day for older adults, but some may need more, up to 1,000 to 2,000 IU per day if blood levels are low. Always check with a healthcare provider before starting supplements and consider getting your vitamin D levels tested. Pro tip: combining vitamin D with magnesium and vitamin K2 can improve absorption and help the body use it more effectively. In summary, vitamin D isn't just for bones. It's foundational for strong, stable legs and preventing those dreaded nighttime cramps. Keep it in balance, and your body will thank you with strength and better mobility. Next, we have magnesium, often referred to as the muscle relaxer mineral, and for good reason. Magnesium plays a critical role in over 300 biochemical reactions in the body, including muscle function, nerve transmission, energy production, and electrolyte balance. It helps muscles contract and relax properly, and when your levels are low, muscles may cramp, spasm, or feel weak. According to an in-depth article by Healthline and supported by clinical evidence from the National Institutes of Health, magnesium deficiency is a known contributor to muscle cramps, especially in older adults. And it's not just a minor discomfort. For many seniors, these leg cramps occur at night, disturbing sleep and increasing the risk of falls when trying to stand. But what causes low magnesium levels? Age-related changes in kidney function, certain medications like diuretics or proton pump inhibitors, digestive issues, or poor dietary habits can all reduce magnesium levels in the body. Signs of magnesium deficiency may include frequent leg cramps, especially at night, muscle spasms or twitching, fatigue or general weakness, numbness or tingling heart, palpitations in some cases. Food sources of magnesium. One of the best ways to boost your magnesium is through food. Some great sources include leafy greens, especially spinach and Swiss chard, almonds, cashews, and pumpkin seeds, whole grains like brown rice, quinoa, and oats, legumes including black beans and lentils, bananas and avocados, which also supports muscle health. While food should be your first choice, some seniors may need supplements, especially if absorption is impaired or dietary intake is low. Common forms include magnesium citrate, easily absorbed, may have a mild laxative effect. Magnesium glycinate, gentle on the stomach, great for muscle support and sleep. The recommended daily intake for adults over 50 is around 320 milligrams for women, around 420 milligrams for men. Always consult your healthcare provider before starting supplements, especially if you have kidney issues or take medications that affect magnesium levels. Quick note: magnesium works synergistically with calcium and vitamin D, so maintaining a balance of these nutrients enhances overall muscle and bone function. Now let's talk about vitamin B12, often called the energy vitamin, but its real power lies in how it supports your nervous system, especially the nerves that control your leg muscles. As we age, our body's ability to absorb B12 from food decreases, and that can lead to subtle but serious issues like muscle weakness, numbness or tingling in the legs, balance problems, and even leg cramps. A study published in the journal Neurology found that low levels of B12 are strongly linked to impaired nerve conduction and muscle control, particularly in the lower limbs. The Harvard Medical School also warns that a deficiency in B12 may mimic symptoms of dementia or neurological disease in seniors, but often it's just a treatable vitamin imbalance. Why is B12 so important? It's essential for maintaining healthy nerve cells and the myelin sheath that protects them, supporting red blood cell production, important for delivering oxygen to muscles, aiding DNA synthesis and cell repair, which helps with muscle recovery and strength. Signs of vitamin B12 deficiency include muscle weakness in the legs, numbness or a pins and needles sensation, difficulty walking or maintaining balance, fatigue and brain fog, pale skin and shortness of breath, Who's at risk? Seniors are especially vulnerable. After age 50, the body's production of stomach acid declines, which is needed to absorb B12 from food. Others at risk include people on metformin for diabetes, those using acid reflux medications, vegans or vegetarians, since B12 is found in animal products. Top food sources of B12: eggs, especially the yolks, milk, and dairy products. Fish, like tuna, salmon, sardines, meat, and poultry, including liver-fortified cereals and plant-based milks for vegetarians. Supplementation. Many older adults benefit from B12 supplements, either in pill form, sublingual drops, or monthly B12 injections in more severe cases. The recommended daily intake is 2.4 micrograms, but many healthcare providers suggest higher doses for seniors with low levels, as B12 is water-soluble and any excess is safely excreted. Pro tip: combining B12 with folate, B9, and B6 enhances its effectiveness, especially for nerve and cardiovascular health. Coming up next is potassium, a vital electrolyte that acts like a messenger between your muscles and nerves, helping them communicate clearly and efficiently. When it comes to muscle cramps, especially in the legs, low potassium is often one of the first culprits. It's not just about hydration, it's about your body's ability to keep muscles functioning properly without painful contractions. A study from Johns Hopkins Medicine highlights how imbalanced potassium levels can lead to muscle cramps, fatigue, and even heart rhythm disturbances in older adults. As we age, potassium levels may fluctuate more easily due to medications like diuretics, blood pressure pills, or even just reduced intake of fruits and vegetables. Why is potassium so important for your legs? It regulates muscle contractions and prevents sudden spasms. It helps flush out excess sodium, reducing blood pressure and swelling in the legs. It maintains electrical signals in nerve and muscle cells. It supports overall circulation, reducing that heavy, tired feeling in the legs. Signs of low potassium, hypokalemia, include muscle cramps and spasms, fatigue or muscle weakness, tingling or numbness in the legs, heart palpitations, constipation, and irritability. Top potassium-rich foods for seniors. 1. Bananas, a classic source, but not the only one. 2. Sweet potatoes, loaded with potassium and fiber. 3. Spinach and other dark leafy greens. 4. Avocados also provide healthy fats for joint support. 5. Oranges, cantaloupe, and kiwi. 6. Beans, lentils, and yogurt. Important note: too much potassium, especially if you have kidney disease, can be dangerous. It's always wise to check your potassium levels with your doctor before using supplements. Daily recommended intake. Adults should aim for about 2,600 to 3,400 milligrams of potassium per day, depending on gender and health conditions. Potassium tip: combine potassium-rich foods with adequate hydration. Dehydration can cause potassium loss, leading to more cramps, so drink plenty of water and balance it with the right minerals. When most people hear calcium, they think of bones. But what many don't realize is that calcium plays a critical role in muscle contraction and relaxation, especially in the legs. Calcium acts like the gatekeeper for muscle movement. Without enough calcium, muscle fibers can't contract or release properly, often resulting in painful cramps, muscle stiffness, and twitches, particularly at night. A report by the National Institutes of Health reveals that low calcium levels, a condition known as hypocalcemia, can lead to neuromuscular irritability. meaning your nerves and muscles start misfiring. This is even more dangerous in seniors, where cramping can lead to loss of balance, falls, and long-term injury. Why is calcium essential for leg muscle health? It supports strong bone structure, reducing the risk of leg fractures. It helps trigger muscle contractions, allowing you to move smoothly. It plays a key role in nerve transmission. It prevents involuntary spasms by calming nerve activity. What puts seniors at risk for calcium deficiency? Reduced absorption of calcium with age, low vitamin D levels, which affect calcium absorption, diets low in dairy or calcium-rich vegetables, use of certain medications, such as corticosteroids or diuretics. Top calcium-rich foods for seniors: low-fat dairy, milk, yogurt, and cheese, leafy greens, kale, bok choy, broccoli, canned sardines or salmon with bones, fortified plant-based milk, almond, soy, oat, tofu, chia seeds, and almonds. Daily recommended intake. Adults over 50 should aim for 1,200 milligrams of calcium per day, according to the National Osteoporosis Foundation. Supplementation. Caution. Too much calcium, especially from supplements, can increase the risk of kidney stones or interfere with the absorption of other minerals like magnesium and zinc. It's best to get most of your calcium from food and only supplement if advised by a healthcare provider. Pro tip: pair calcium with vitamin D for better absorption. Calcium builds and supports, while vitamin D makes sure it gets where it's needed. Vitamin E isn't just for skin or immune health. It's a vital antioxidant that protects your muscle cells from damage caused by oxidative stress. As we age, our body's ability to combat free radicals diminishes, and that oxidative damage can lead to muscle fatigue, weakness, and even inflammation, especially in the legs. A 2018 study published in Free Radical Biology and Medicine highlighted that vitamin E helps maintain cell membrane integrity in muscles. It essentially acts like a shield, defending your muscles from the wear and tear that leads to cramps and degeneration. Why vitamin E is important for seniors' leg strength? It reduces oxidative damage in muscle tissue, enhances blood circulation, especially in the legs, supports nerve health, helping to prevent tingling or numbness, assists in faster muscle recovery after physical activity, may prevent claudication, leg pain caused by poor circulation. A clinical review from the University of Maryland Medical Center found that individuals with intermittent claudication, a condition that causes leg pain during walking, experienced improved circulation and reduced symptoms when supplementing with vitamin E. Top vitamin E-rich foods for seniors: almonds, sunflower seeds and sunflower oil, spinach and Swiss chard avocados, peanuts and hazelnuts, butternut squash and kiwi. Daily recommended intake. The RDA for adults is around 15 milligrams per day. Most people can meet this with a balanced diet, but supplementation can be considered in cases of deficiency. Supplementation. Tip: choose natural vitamin E over synthetic forms, as it's more bioavailable. However, high doses may interfere with blood-thinning medications, so always consult your healthcare provider first. Vitamin E works even better when paired with vitamin C, which helps regenerate vitamin E in the body and boosts antioxidant activity. This dynamic duo protects both muscles and blood vessels. Let's talk about the last but not the least: omega-3s. The healthy fats that do more than just support your heart. They're crucial for your muscles, especially in your legs. As we age, our muscles naturally lose mass and strength, a condition known as sarcopenia. Inflammation, poor circulation, and cellular damage all contribute to this decline. But omega-3s fight back on all fronts. A groundbreaking study published in the American Journal of Clinical Nutrition in 2015 found that seniors who supplemented with omega-3s for 6 months experienced significantly greater muscle strength and function, even without intense exercise. Researchers from Washington University School of Medicine also reported that omega-3s help activate muscle protein synthesis, the key to maintaining muscle mass in aging bodies. Here's how omega-3s support strong leg muscles: reduce chronic inflammation in muscles and joints, improve blood flow and nutrient delivery to muscle cells, help preserve muscle mass and strength, aid in muscle recovery after physical activity, support joint health, making movement smoother and less painful. Omega-3s are especially helpful for seniors with conditions like arthritis, diabetes, or poor circulation, because they help reduce the inflammatory load on the body. Top omega-3 rich foods for seniors: fatty fish like salmon, mackerel, sardines, flax seeds and chia seeds, walnuts, algal oil, a plant-based option for vegetarians, omega-3 enriched eggs. Recommended intake: for general health, around 250 to 500 milligrams of EPA and DHA per day. For anti-inflammatory benefits, 1,000 to 2,000 milligrams per day, under medical guidance. Tip: when choosing an omega-3 supplement, look for one that provides both EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. And always choose one that's third-party tested for purity and potency. Omega-3s may not act overnight, but over time, they can transform the way your legs feel and function. From reducing inflammation to helping your muscles repair, these healthy fats are the quiet guardians of your mobility. Strong legs are the foundation of a strong life, especially in your golden years. By ensuring adequate intake of these essential vitamins and minerals, you can maintain muscle strength, prevent cramps, and enjoy an active, independent lifestyle. If you found this video helpful, please like, comment, and subscribe for more health tips tailored for seniors. Share this with someone who could benefit from stronger legs and fewer cramps.